It then goes into a dark brown and almost to a black consistency. So just using microsuction in the left ear. This technique is called the tragus technique. So the reason why I'm making reference to that is just we had some clear wax delegates attend our training course today, and I was going through all the techniques that I use, and we of course practice these techniques with the delegates, so I want them to be familiar with the technique that I'm using to remove this plug of wax, and see it's come out in a big single mass. If you watch right to the end, you'll see a procedure that I performed today at the training course. It was on one of the delegates. They've got a complex ear history, and for that reason, and quite rightly, they weren't comfortable with anyone else, any of the trainee delegates going into the ear and performing any procedures. But obviously, of course, they were happy with me to remove a plug of wax. If you stay tuned right till the end, it's like a bonus clip. So the patient's left ear is clear, nice healthy eardrum. You could visualise all the landmarks on the eardrum, including the hammer bone. Also the chorda tympani, which is the nerve of taste. It attaches to the anterior part of your tongue. And that particular nerve, the chorda tympani, runs just behind the eardrum. Just in the right ear here. So this wax is a bit more stubborn, it's a bit more occluding. And we're just trying to detach it. See, there's a lot of keratin as well. You can see this tail that's protruding outwards. That's some dead skin. You can tell by the appearance it's very glossy. So what I'm trying to do with the suction probe is just detach this wax plug from the ear canal wall to mobilise it. And once I mobilise it, I can remove it. You can see I'm just giving it a little wriggle there. Now, the reason why I didn't use an ear hook is because this wax is a bit soft as well, so an ear hook will just dice through it like a hot knife through butter. Oh, sorry, I just hiccuped there. It will just dissect through it like a hot knife through butter. And with the Jobson horn, it's just a bit too deep, so we're going to have to go into the bony part of the ear canal, which, again, one of the things I explained to my clear wax delegates today is you want to avoid mechanical instrumentation like hooks and scoops in the medial inner 2/3 of the ear canal. If possible, it's not always possible. And that's because it's the bony part of the ear canal which is very sensitive. And sometimes on the bony part of the ear canal, you could have bony protrusions that are not visible. And if you go in with a hook and scoop and you make contact with those protrusions, it can be very painful for the patient. And again, just for the reference of the delegate, so this is the right ear, so we're positioning the endoscope bottom left of the ear canal, and I'm stretching the ear open to the left to widen and straighten the ear canal, which then allows me to safely insert the endoscope into the ear, and I'm using the tip of the endoscope as a guide, so we're looking into the ear, delicately inserting the endoscope, the suction probe, into the ear over the tip of the endoscope, so it's safely in the ear, and then we're just extracting that plug. Again, that's the patient's eardrums, nice and healthy, just a bit of debris around the edge, just going to gently mop that up. So as I said, if you just stay tuned, in a moment you will see the bonus clip. And you're going to see a quick video of all the debris that I've removed, all the wax, keratin. So there's a couple of large lumps. And this is the additional clip. So this patient had severe ear infections growing up. They've had previous surgery to the ear. You can always see that on the back side of the eardrum, it's all scarred. That's tympanosclerosis. So I just delicately, because there's an opening there, I managed to get the ear hook safely into the ear. I knew I wasn't going to touch the bony part of the ear canal as there's an opening. Slowly extracted it, and you can see all that scar tissue. That's tympanosclerosis. They've got a retraction at the top, the attic region, and they have got a mild hearing loss here. Well, I hope you enjoyed that video.